Right.
Over to you, Sanjay bhai.
Thank you, Dada. Just on, first of all, on behalf of everybody at the committee at Gujaratis in the UK, thank you so much for attending this very, very important Zoom conference meeting today. As you can see, we've already reached the peak of 500, and it looks like there's nearly another 500 still trying to come through on the waiting room. So, you know, we could have probably done this Zoom seminar twice over, the number of people that are still trying to join in. But for those of you who haven't been able to join in, if you've got friends and family, please do tell them to join us on Facebook Live as well, so they'll be able to watch that not just in the UK, but throughout India as well. The second event that we've done in the last couple of months, if you remember last month, we did International Men's Day, where we had great eminent speakers who came on board and spoke about the value of men in society as well. We always have Women's International Day, but last month we celebrated Men's International Day as well. A very, very great event, some eminent speakers. And today we've gone one step further. We've got three absolutely fantastic eminent speaker. But before we pass on to them, it gives me immense pleasure, first of all, to introduce a very, very good friend of Gujaratis in the UK, and someone who's always supported us in everything that we've done. And that is Ajita Jain, who's a senior journalist and a newscaster, and also the executive editor as well. A very, very well-known, popular face in the Indian television industry, following a glorious journalistic journey for 2 decades with premier news channels of India. Ajita is recognized as a firebrand newscaster and known for her intellectual debates. Her fearless approach and journalistic skills in covering political, social and economic events of prime importance nationally and internationally make her a very, very distinctive media professional. So for our guests on today, no pressure at all there. A philanthropist by heart, Ajita is also a journalist by mind and inspires to be a practitioner of journalism with a purpose. She has carved a niche through prime TV stations focusing on health and education, committed to bring positive changes in society with the help of the right information and easy communication. Ajita's affiliation of vast, News World International, Times of India, Z News, Sahara, Samay News and ETV. It's a really, really honor for us Gujaratis in UK to welcome Ajita. Please, everybody, it's 10:30 in the evening in India where Ajita is joining us from. So please, can I pass over now to Ajita Jain? Thank you very much.
Thank you so very much, Mr. Sanjay Jagatia, for those kind words and that long introduction. I indeed feel quite honored being with you all, and especially the kind of panel that we have today. And it gives me indeed an immense pleasure to be talking on the subject which is very close to my heart, the health. So since I've worked a lot on health, and you, as you also mentioned, so thanks a ton there. Good evening, everyone. And a very warm welcome to all of you on this very special session on COVID-19, knowing all aspects. As we all know, COVID-19 has disrupted the world and undermined progress on all of the global goals. The vaccination drive, which is underway, is something that has brought a lot of hope and positivity amongst individuals, though with its share of concerns, undoubtedly. So what is the vaccination strategy? How it works? Who's going to get the shot when? How effective it is? We'll be talking about all of this and more. Also, we'll be talking about the new mutant of coronavirus that has created a lot of panic, not only in UK, but all around the world, due to which UK is witnessing one of the strictest lockdowns of its times. Is it really deadly? What are the plans to deal with it? All of these are going to be answered by a very eminent panel here today of medical experts. So it's my great pleasure to introduce Professor Dr. Bharat Pankhania, Senior Clinical Lecturer, University of Exeter, Infectious Disease Expert. He has a widespread experience of advising on national communicable disease control action plans at national and international level. As a senior consultant in communicable disease control, he has a vast experience on outbreak, pandemic influenza outbreak planning and major plan testing exercise. He has been a local lead for pandemic influenza planning at Public Health England and became the reference point for testing and control strategy. A very warm welcome to you, Professor Dr. Bharat Pankhania. And
Namaste.
Namaste. And Dr. Yogrendrasinh Jagatsinh Solanki is our second panelist today here. Again, a very, very eminent medical expert here. He's a clinical director for elderly care and rehabilitation. A very warm welcome to you, Dr. Solanki.
Yes, thank you very much. Namaste.
And the third panelist, again, I'm very honored to introduce him, Dr. Vijendra Ingle. He's ENT surgeon in Royal Free Hospital, London. Very warm welcome to you, Dr. Vijendra Ingle.
Thank you.
So all of our medical experts, ladies and gentlemen, have been in the thick of things, have been the front line warriors, as we call these days. So coming to you first, Professor Dr. Bharat Pankhania. Well, two things that have generated a lot of discussion and debate all around the world. First one is a good news, the vaccination, and the second one, not a very good news, the mutation of the coronavirus. So I think let's talk about good things first. To be or not to be is the question. So everybody is discussing these days, should I get vaccinated or not? What are your thoughts on that?
Oh, without a doubt, in the shortest possible answer, yes. I am an expert in immunizations. I spent more than 20 years in preventing, protecting lives through the medium of immunization. And the absolutely marvelous thing that we need to celebrate is a new platform of vaccines have been invented. And I want to tell you about the new platform because it's really exciting. It is going to revolutionize the delivery of medical care, not only for coronavirus, SARS-CoV-2 infections, but for other things as well. So in answer to your question, vaccines, wonderful. They will save lives. They will save humanity. And I'm very proud to also acknowledge that India is the biggest manufacturer of these vaccines. So we have the Serum Institute and the Bharat, my namesake, producers of the vaccines in the in India, and they are going to save lives. If I may take a few seconds to explain to our people what these vaccines do, what they don't do, or should I go into that later?
No. Sure. You can please carry on.
Okay, so look, I'm so excited about it. It really is absolutely fantastic. And we need to sort of pay homage to engineers. We forget, the medical people seem to think that they are the only heroes of this thing. Actually, I want to say thank you to the engineers as well, because the Pfizer BioNTech vaccine, Moderna vaccine is a marvel of both science and engineering. Let me tell you how and why. So we have the messenger RNA. So that is a tiny molecule, very tiny, of instructions. The best way to describe it is like a computer code. It does one thing and one thing only. So the computer code, which is in the mRNA, which stands for messenger RNA, is make me the spike protein. The spike protein that is on the surface of the SARS-CoV-2 virus. So the mRNA, our job is to get the mRNA, the little molecule, into your cell. And once it has entered your cell, it links up with the ribosome and manufactures the spike protein. How to get this molecule in is the difficult bit. So the Moderna, Pfizer, BioNTech group have come up with the idea of coat the molecule, coat the mRNA molecule in a lipid membrane, a nice, quiet little golf ball. In other words, an outer casing of a lipid membrane, and the inner bit is the molecule of the mRNA. And it is a nanoparticle. It is a tiny particle, 10 to the minus 9 meters. And we inject this underneath your skin into your muscle. And this tiny little particles find their way into your cell. And when they enter your cell, the lipid membrane dissolves and it releases the mRNA. The mRNA released goes to the ribosome in your cell, and it tells the ribosome, make this protein. So it makes this protein, and it puts these proteins as projections out of the cell. Almost home now. So when your body's immune system sees this protein, it says, this doesn't belong here. This is alien. This is not my protein. So it activates the immune system. And the immune system, there is two branches to it, the cellular and the humoral side. So it activates the immune system to say, remove this protein from my body. And that's how the immunity is made and immune memory is made with the vaccine. And then afterwards, the mRNA just dies and it's destroyed. So it doesn't carry on making more and more and more of the spike protein. It only makes so much, and then that's it. The AstraZeneca vaccine uses a different technology. It uses the same instruction, the code, to get in to your cell, care of a chimpanzee common cold virus, an adenovirus that carries the instructions into your cells, and then the cells do the rest. The Sputnik 5 uses the same technology, same everything, except it uses the human adenovirus to carry the messenger into your cell and then make the instructions, make the immunity, make the immune memory, and then you are protected.
Right. So very beautifully described there, but I'm sure a lot of people, since they don't belong to medical fraternity, you have made it quite easy for them to understand what does a vaccine do to you. But a lot of safety concerns are also being raised as far as these vaccines are concerned, especially the Pfizer one, as we have seen that it has reacted to some people, as has been reported. So what do you have to say on that? So people just want to know that, should I take the vaccine? Is it safe for me? Is it not safe for me? Especially not only healthy individuals, but people with comorbidities like hypertension, diabetes, and other such ailments.
Very happy to answer all of those questions, because all of this is my bread and butter. So it's my pleasure, really. And before I go on, I want people to realize I'm not a government doctor. I'm talking from the heart, and I'm an independent doctor. Nobody tells me what to say, what not to say. I don't belong to the NHS. I don't belong to Public Health England. I'm not a government doctor. I'm independent. I come from University of Exeter. So here we go. Safety profile. Well, people asked, how is it possible to invent a vaccine in less than a year? Well, the reason why we've been able to create a vaccine in less than a year is because all the hurdles, the bureaucratic hurdles and lack of funding is removed. So we accelerate all the help that you need to do your research work in record time. And by being able to do this in record time, we came up with a vaccine in about less than a year. It's not that corners were cut. Furthermore, when you've created the vaccine, you publish your data to the regulatory authorities, and the regulatory authorities check quality control. Is your laboratory clean? Is your laboratory safe? Are you bottling it properly? Are you marketing and presenting it safely? And what are the side effects? So coming on to the side effects, we have known side effects. In other words, when I inject you, like with all vaccines, you may get a temperature, you may get an aching arm, you may get aching muscles, aching joints, you may get a headache. All these are known side effects of most vaccines. In fact, it is a good sign. It is telling you that your body has recognized this thing that I have injected inside you, and it is busy making antibodies and immune memory against the injection I gave you. Finally, who is it not suitable for? It is not suitable for a very small number of people, a very small number. I come on to that in a minute. So because it is just mRNA and a little bit of lipid that we're giving to you, it is suitable for most people. It is not live. So it is not a live attenuated virus. It is just instructions. You can give it to people. So
what about the severe allergic reaction? Sorry to interrupt you there.
I'm coming on to that. So who do we not give it to? Well, we don't want to give it to mothers who are, ladies who are going to be mothers. In other words, pregnant ladies. We don't want to give it to them. We don't want you to breastfeed if we have given you the vaccine. We don't want you to get pregnant if we have given you the vaccine. So you don't get pregnant I think it's 2 to 3 months post-vaccine. So you have a break, okay? Now then, in answer to your question, Ajita, with respect to allergies, so we know what we know. Sometimes we come across what we don't know. So we found two healthcare workers in the United Kingdom who had a tendency to severe allergic reactions to many things. So they were allergic to A, B, C, D, E, F, several things. And they carry an EpiPen with them as well. So these were severe allergic people, not minor allergies, severe allergies. And they reacted to, we don't know exactly which component of the vaccine, but they are fine. They're absolutely fine, full recovery, etc. So who do we not give it to? I mentioned the pregnancy issue and people who are contemplating pregnancy. And the other one we don't want to give it to is people with multiple severe allergies, not a singular one allergy, mild allergy. Multiple severe allergies is the defining line. We don't want to give it to them because we don't know how they will react to the vaccine. But otherwise,
So that means,
it is safe to give to people who are immune suppressed, blood pressure, heart disease, anything, name it. It is safe for most groups, better than most vaccines.
Okay, so you mean to say that only people, ladies especially, who are into their pregnancy or are planning to get pregnant should avoid it, and people with multiple allergies should avoid it. But then the question arises, it's a pandemic and everybody wants to get themselves vaccinated. They want to protect themselves. So what is the way out for them?
Well, no, there's a plenty of way out for them. So one, pregnancy only lasts 9 months. Think about it. Second, other platforms will be coming on board as well. So AstraZeneca, Sputnik, and all the others, the Indian ones are very interesting ones from India. They will all be coming in. I don't know the data sheet on all of the other ones. So it isn't a case of I wasn't immunized with this, so I can't get immunized with the others. Finally, one more point also is by the time a large proportion of the population has been immunized, infection rates start to drop and you get protection from what we call immunity by herd immunization. And so they also get the benefit of, I can't be immunized, but I'm protected because the nation has all been protected too.
Great. So let me, well, we have many other things to discuss on vaccination, but let me very quickly involve Dr. Vijendra Ingle also. As I said, that he's ENT surgeon from Royal Free Hospital, London. Dr. Vijendra Ingle, what are your thoughts on the safety of vaccines and which vaccines are currently being used in UK? Because we all know that Pfizer is the first one that is being used, but then there are reports that very soon the Oxford AstraZeneca would also be out. So has it already started being used there in UK, or how long one will have to wait? And I would also like to understand the difference between the three vaccines, especially that when we talk about which are there almost that have passed all the clinical trials and are ready for the use, the Moderna, the AstraZeneca, and the Pfizer one.
Okay, thank you, Ajita, for this kind introduction. And first of all, thank you, Yogrendrasinh Jagatsinh, Dada, we call him Dada, for inviting me as one of the speaker here. And it's a great pleasure to be with all these esteemed panelists and audience as well. So here I'll speak on my personal behalf, not as a representative from the Royal Free Hospital, just a small disclaimer. Okay, so the question you asked about is the vaccine. So at present, we have been given vaccine of Pfizer BioNTech. And as Bharat Bhai had said about this as a lipid nanoparticle into the mRNA, and after that, they have prepared the vaccine on that. So this is the vaccine at present available for all of us. And all of us means it has been scheduled to be given in a specific pattern. Like high-risk patients are given first, then the health workers who are at the ICU level and accident and emergency, those people who are at high risk, healthcare worker, so those people will get it first. And as an ENT and surgical aspect, like surgeons and all, we are going to get it in the next stage, they said like that. So considering about the vaccines, this Pfizer BioNTech vaccine, so when you see this one, it has got lipid nanoprofile, and as Bharat Bhai has said, the AstraZeneca Oxford has got chimpanzee adenovirus into that. So these are the technical terms, but the main action of this vaccine is almost the same. Like the main action is about preparing your memory cells, and these are the MHC1 and MHC2 cells. These are all nucleated cells and macrophages, dendritic cells. These are the technical terms by which the helper cells and B cells, they produce plasma cells. And these plasma cells attract this interleukins, release interleukins, and they identify the protein. If you see the structure, can you see me? Sorry.
Yes, we
Hello?
can see
Okay.
you. Yeah.
So if you see the structure, there are spikes. So these spikes are S proteins. And all these helper cells and B cells, when they produce plasma cells, they attract to these and they get interlocked with this. And that's how this memory is created in our body, so that different kind of memory cells, they multiply. And the next time when the virus comes and attacks us, it causes the reaction, attacking antibody reaction to that. And that's what antibody is said about. So it uses the host cells. The AstraZeneca Oxford vaccine uses the host cells as enzymes. And the cytoplasma is there. It's translated to make proteins, and this protein again bind to the spikes. And this is how this AstraZeneca vaccine is there. So when you talk about this different vaccine, you ask about what difference is there between this vaccine. At the moment, we only have Pfizer BioNTech, and the other vaccines will be coming. AstraZeneca Oxford also will be coming soon. A Moderna vaccine has the duration. This is also 2-dose vaccine. It's 0 and 28 days. That is Moderna vaccine. And within 14 days, the symptoms are tested and the PCR testing is done for that. The method used for Moderna vaccine was like they had a pool of 3,000 people, and then in that investigation, the testing was done on that. The results were about 94.5% in detail in the disease, and 100% on the severity of the disease. That means like results when they gave that one, so 94.5%. And the difference of this is the storage is at minus 20 degrees centigrade. The difference between this and the Pfizer BioNTech is 0 and 21 days gap. The first is at 0 and the second dose is given at 21 days. And after 7 days, symptoms are to be checked. So this also had a big pool of around 49,000 volunteers. And in that result was around 95% efficacy. So any vaccine, whatever type vaccine is there, the main aim of this is first we see safety, and safety means side effects. And the second we see is efficacy. So efficacy wise, disease producing, and then complete symptomatic relief. The severe symptoms in this Pfizer BioNTech were about 87.5%. The difference between those three vaccines is that storage is there. Storage means it's minus 20 degree in Moderna vaccine. Pfizer has to be stored at minus 70 degrees centigrade. And this AstraZeneca Oxford, here comes the advantage for this, because for India, as we are from Indian origin here, most of us. So for UK and India, it is very important about storage chain. The cold chain has to be, as Bharat Bhai would, from the community medicine would agree, that cold storage is very important, because the temperature is to be maintained for the efficacy and viability of the vaccine. So for that one, AstraZeneca and Oxford, whenever it comes, it would be much better and cheaper, because it can be stored at 2.2 to 7.8 degrees centigrade. That's the temperature of the fridge. So that will be a very big advantage when it comes. And efficacy wise, when you compare it with others, it also has got around 90% of efficacy. 90% efficacy, and result-wise, this also has got 62% efficacy, 90% of the overall efficacy from this AstraZeneca Oxford vaccine. So storage, I told about this one. What else was that? Yeah. So I think these are the three main differences into these vaccines, and hopefully very soon we'll get the Oxford as well.
Okay, so currently there's only Pfizer vaccine
Yes.
which is being given to the people.
Yeah,
So now the
that's right.
question arises, Dr. Ingle,
Yeah.
that who would decide which vaccine, once all vaccines are out there, say
Yeah.
the AstraZeneca also comes and the Moderna also comes and maybe some other vaccines also. So then who would decide which vaccine is to be given and to whom?
I think that's a good question, but
I'll
the
answer.
health capacity wise, I think Bharat Bhai, from the community medicine, he would be the right person to. I will pass on
Look,
to.
I'll quickly answer it
Okay.
for you, which is
Yes.
they will protect you. Whichever one is licensed, they will protect you. What you don't want to do is go shopping. So if you start with Pfizer, you finish with Pfizer. If you start with Moderna, you finish with Moderna. If you start with AstraZeneca, you finish with it. There is very little difference between the efficacy. Eventually, they will all have about the same. Although the test results show high efficacy for Moderna and Pfizer, in real world, you will find that they're all equally as good.
Okay, but then again, a very common question that comes to everybody's mind as a layman, as a common man, is that how long it is going to protect me? Do I
We
have
don't know.
just to?
We don't know.
That's-
We just don't know. And what we will be doing is we will be following up not only people who have been immunized, but we'll be following them up for any side effects as well as presentation with a second infection after immunization. And then we will know. So does it work for 6 months, 9 months, a year? We will find out. But at the moment, nobody knows how long it lasts for.
And
So
I
that's
think
where the catch is. Yeah.
yeah,
Dr.
and I think by the time the studies will go on, like how is the side effects and all those things of different vaccines. But hopefully that by that time herd immunity also will start kicking in once it reaches more than 60% of people having had a vaccine or the virus infection. So we will move towards the herd immunity as well, which might help.
All right. Okay, let me quickly bring in Dr. Jagatsinh Solanki as well. He's the Clinical Director for Elderly Care and Rehabilitation, since we have a lot of people who are in their elderly age at the moment who are joining us here today. Dr. Solanki, very warm welcome to you as well, since
Thank you.
you take care of the elderly care and rehab. The most important question that elderly are facing, of course, is that whether they should be taking the vaccine or not, and how safe this vaccine is for them. So what is your advice for elderly people, and would it work really?
Yeah. So let me take it back to you when we had the pandemic, So in April, when I was looking after all these elderly people in the wards, most of my elderly people got the COVID from within the staff or within somebody visiting. They were actually not going outside. So they were very much vulnerable, what we class as a vulnerable population. And that is when many of them, because of that, old people has a lot of comorbidities, like they have lots of diseases which goes on heart, kidneys, diabetes, all sorts of things goes on. So when these people are affected, the COVID affects really hard, and they do not have a very good immunity to fight against it. So that is why we see a lot of death in the old population. Coming to the vaccination for the old people, if I say that, if my mother and my dad should get vaccinated, I would say definitely yes. Even though they have any diseases, they should definitely get vaccinated. That is my sort of a mantra, Is that, yeah.
Yeah, okay, they should get vaccinated. And as Dr. Pankhania said, that we do not know how long it is going to work. That's yet to be seen.
Yeah.
So But it's always good and recommended to take the vaccine rather than not taking it, right?
Rather, yeah. So if you say so, say we were talking about, so if everybody gets vaccinated, say if we take back
Yes.
to the R0 number, now with the latest studies, they say that the R0 may be up to 5 or 5.7 or something like that for COVID. So we require 82% of the people to get vaccinated in a society to get a herd immunity. So 82% of the people should get vaccinated. Once if we achieve that, I was reading a calculation, we can achieve that by August next year by doing a vaccination program, about 80% we could get vaccinated. And that is when the disease can automatically die out. And that is when everybody else will be protected. So that is how I would see the picture, you know.
Okay, so what is the plan of vaccination there in UK, since it's already underway, the drive is already underway?
So at present, everybody in the hospital or the GPs, they are calling everybody who is above 80 years for a vaccination program. So the GPs and, you know, around in my area in the hospital, that is what we do. We also inject everybody in the care homes. We also inject everybody who are looking after the old people in the care homes, so the care workers, and also we are injecting the hospital staff. So that is where we are starting the project with the Pfizer vaccine, and then it will be rolled out to a lesser age, that is 65 and overs, and that is how it will work.
So how long this entire process is going to take, and anybody would have a very obvious question in their minds that, you know, when is my turn going to come?
I think by next February or March, I think most of the 65 plus years should be able to get vaccinated. That is what I would have thought, so, you know. But I am not into all those planning and things, but that is my take on things, you know.
All right. Okay, Dr. Pankhania, coming back to you. Prime Minister of UK, Boris Johnson, he himself has been a victim of COVID, and in the current situation where the new mutant of the coronavirus has been identified in UK, I would like to understand from you, and as Boris Johnson said, that when the virus changes its method of attack, we must change our method of defense. So he has changed the method of defense by putting a severe lockdown, but medically, what would that defense be?
Well, when we have an interface of politics and health, there's always a lot of spin in the matter. So for the benefit of all our viewers and listeners, let me reassure you, whilst we have a new lineage, we call it a new branch of the SARS-CoV-2 virus. So imagine a tree, lots of branches, and then a offshoot arises and it becomes a large branch, a large trunk in that tree. That's what the new mutations have led to, okay? Mm-hmm. What's the big deal about it? Very little. So maybe, the big word is may in big, bold capital letters. It may be more infectious, right? There's a lot of spin that it is more infectious. My answer to you is maybe it is more infectious because just because it has become the dominant strain doesn't mean it has become dominant because it is more infectious. It may have become dominant because you are all going out shopping for Christmas and presents, and you're going to people's houses and you are interacting with humans on buses and trains and all those things. That can also make it a dominant strain. However, we are where we are. The good news is that the new strain is not more disease causing. Good. The new strain may be more infectious. Okay, so take your precautions, and all the precautions that you have been taking, you should continue to take and take them properly. And the easiest way to remember the precautions are the 3 C's. This is what the Far Easterners, Japan, has been doing, and it works very well. So avoid crowds, avoid places with lots of human beings, crowds, avoid coming close to other human beings, and avoid closed spaces. So you need good ventilation, avoid the crowds, and avoid getting close to other people. You do those things, you're in a good place. One more thing, something that we don't do very well as a community and as a society, and all people really, is wear your mask properly. So we have in the audience and on the panel many, we have doctors on the panel. We know how to wear our mask, but we assume members of the public also know how to wear their mask. It's not true. So you wear your mask tight fitting, covering your nose, covering your mouth tight, and it has to be covered it and snug fitting. So it's a tight fitting mask. And of course you do the other things as well, which is the 3 C's I mentioned to you, as well as wash your hands. People say, wash your hands. Well, I say, listen, you timetable it. So every 2 hours you go and purposefully wash your hands. But it's not only washed hands, it's washed and dried hands that are safe. So you continue with all those precautionary measures and you'll be fine. If you go out mingling with other people and interacting and partying, etc., you will get infected. Finally, so Prime Minister Johnson changed the 5 days of Christmas blank check to saying, don't do it. Health experts like myself have been saying 5 days of Christmas was a bad idea. You should never have allowed it in the first instance. So that's one thing. Second thing, even today on the 23rd of December, my advice would be, if you can, do not get together, do not mix, cancel 2020, because 2021 is going to be a better year. So your investment is cancel 2020 Christmas, and your reward, your dividend is a better 2021, especially as the vaccines are around the corner. And one more thing, don't take this lightly. Hospitals, my colleagues on the panel will tell you, hospitals are nearly full. To get admitted to hospital takes between 3 to 6 hours. You don't want to die in the ambulance. You don't want to die in the corridor. You don't want to die because we can't give you a hospital bed. Don't get infected. Don't infect others. It's very simple.
Of course, prevention is the best cure, as it is said, Dr. Pankhania. But there I would like to go back a little to your words where you say that this may be more infectious. What does it mean by that, more infectious? Is it the real cause of the numbers that are spiraling up, or is it causing more serious health concerns? Is it attacking new organs of the body? What does it mean?
Okay, as I said to you, it may be more infectious, meaning you need a lower loading dose to get infected. So what you want to do is, if you got infection control practice, meaning you wear your mask, but you don't wear it properly, then from today, from this minute onwards, wear your mask and wear it properly. Secondly, do all those things that I told you to do, you know, the crowded places, the crowded closed indoor place, and being close to other human beings. If you follow all those measures, you will be fine. You will be safe. This virus, the new strain, either from the United Kingdom or South Africa, is not more disease causing. That's the good news, meaning there is no evidence that it makes you more ill. The only evidence is it may need a fewer number of virus particles to infect you. But you take care. You have infection control. You avoid people. You avoid crowds. You live in a good ventilated building. You will be fine.
Okay, great. Dr. Vijendra Ingle, what do you think about this? Has this suddenly happened, this new mutation that we are talking about, and how it emerged? Any idea? Did it emerge in UK, or was it identified in UK but emerged elsewhere? Do we have any evidence of that? Any reports on that?
Regarding this virus mutation, it's all the viruses are known to mutate actually. And considering this COVID virus, normally virus mutates is a slow mutation and fast mutation, just some technical terms. So COVID goes into a slow mutation. If you see that the last year, this COVID was detected, and then from almost 1 year, there was no mutation. And when the studies were going on in September 2020 onwards, that is the time where they detected this new mutation. And this mutation was detected in Denmark, Australia, some European countries, Germany, and recently in US as well. So, but mainly in UK, it was detected in September, and then studies were going on that. So what they found was that on the spikes, when you see the spike of the COVID, this one was a 501 spike on that one. That spike got mutated, and this some spike was the 99% of the spikes were good, but that few of them got mutated. So in this mutation, what happens is that this is called as N2Y mutation, and it is 501 N2Y. In this mutation, this protein, this attaches to the cells. And when this cell attaches, there is ACE2 receptor, and this changes faster. And due to this change of that spike very faster, in that situation, the virulence increase. The virus virulence increased to 70% almost. And to tell you the hospital thing about this change mutation, in earlier spike in April, May, June, that time we used to see like more of a patient with comorbidities and elderly patient, 60 plus and all getting into the hospital. But the new trend which we have seen, I think Dr. Bharat Bhai also would put some light on this. Our side we have seen, because last week I have seen two patients. One was 19-year-old girl and another one was around 30-year person. So these are the changing age groups also, because earlier it was thought that, oh, young person are spared, young person spared. It's not like that. Anybody can get it. And asymptomatic people are also coming ahead, because we're testing, and then earlier days you used to have loss of smell and taste sensation, because as an ENT surgeon we used to see the patients. We have to do any investigation and all. It was causing concern at that time. But nowadays, without symptoms also we are getting, and these are the people who can go ahead spreading the virus. So that's why the virulence has increased, asymptomatic patients have increased. But as Bharat Bhai said, the severity, patient going to the ICU level or getting admitted, that level is slightly less than earlier. That is what we think clinically.
Okay, so this virus is not doing anything different than what it was doing earlier. Dr. Solanki, what is your experience on this new mutation of a virus? What kind of cases are you seeing? What kind of patients are you dealing with?
If I give you a very simple analogy of a Bollywood film, say, suppose you have a villain in the film. He disguises himself to get an entry into somewhere, like he will wear a specs or he will have grow beard and things. So that is what the viruses do to get entry into the host. That is their nature, But by doing that, some of the viruses, they do become more infectious because they want to stay in the bodies for long, and that is how it happens. We have not seen any different pattern of more clinically ill patients. Those are not seen. In fact, we have seen that the virality of this virus has been lesser and lesser. Like recently, I had about 10 patients who were admitted in my hospital. They were already in the ward. They have never been out because the old people requires a long-term admission. They all got it from somewhere, from the staff or a carrier or somewhere. All those 8 ladies, they had all the comorbidities. All of those 8 ladies and gentlemen, they recovered well and they went home, which was not the case in April and May. So I would say, I think it is okay, more contagious, but it is less
severe.
Yeah.
Okay. Dr. Pankhania, what are your views for the vaccines to be used for children? Are they suitable for children as well? And you think that children will also get the vaccine?
It's a very important point. So the experiments, the trials were done in the older age group and the younger age group, not in the children. So, and the reason, and there's a big reason important for this, is we felt that the children do not suffer from severe illness if they were to get COVID disease. And therefore the licensing is not for the children, but for the older age group and the 20, 30, 40 and upwards age group, etc. In time, we will get more data for the immunization of children, and I'm sure we will do it. But the priority groups are the ones who are very vulnerable, who, if they get illness, will die, followed by, this is very important, very, very important. So people like myself are also advocating. Tony Blair today was also saying the same thing, Prime Minister of England, former Prime Minister of England, is we should also have a mass vaccination program in tandem with immunizing the vulnerable people. So what then happens is, instead of going category by category by category by category in immunizing people, what you do is you immunize a large group of people immediately, as fast as you can. And that way you build up herd immunity. So as the percentage of people immune increases, fewer and fewer people are ill. And that way the nation starts to breathe a sigh of relief and get control over the widespread disease and outbreak. So that's the strategy for immunizing.
Yeah, but what would be the minimum age to get vaccinated?
Well, at the moment, it is from it was only tried out in adults, so 18 upwards. It was
60.
not tried out in children. Therefore, it hasn't been licensed in that group. But that does not mean later on there will be changes to the licensing to immunize children as well. It's just not at the moment.
Okay, and what about people who have recovered from COVID? Do they also need vaccine? Because what is widely believed is that once I have got COVID, now I am immune to it for the rest of my life. Is this true or is this not true? And what would you say for them?
Well, the answer is we don't know how long immunity lasts. So therefore, if you have had your COVID disease, you can still be immunized. What will happen is you will get a boost of immunity, this time without becoming ill, without having the illness, but just the injection. It is a bit like you have the flu, but I still give you the flu vaccine the next day. Some people have the MMR vaccine, but they forget that they've had it. So I give it to them the 4th or the 5th time because they've just forgotten. It doesn't make them more ill. So you can have the vaccine even if you've had the illness.
Okay, and what would be the time gap between their recoveries and getting the shot?
Well, ideally, you don't want to be immunizing anyone who has an intercurrent illness. So empirically, I would say it is better to allow at least 3 months post-disease before you say, I'd like to be immunized with the available vaccine, at least 3 months. Because what you don't want is an interference of your immune system when you have the injection and say, ooh, here it is again, and you don't make immune. Because the whole idea of being immunized is to make immunity. So if you've already got a primed, pumped up antibodies circulating, it neutralizes the immune making process. So you don't want to do that too soon, minimum 3 months.
Can I say something on this, Ajita? Can I?
Yeah, sure, please.
When the pandemic happened, we, all the doctors, the nurses, healthcare workers had the infections, but at that time we were not tested because the tests were not available. So we don't know we had the infection, but we thought we had the infections, and still everybody who had the infections, many of them are still getting vaccinated. So it is ongoing. Yeah.
Yes.
Mm-hmm. Okay, I'm receiving a lot of questions also here. And one question that I just saw is if somebody is bedridden and he is 85 plus, he is bedridden at home. So what is the plan for him to get vaccinated at home?
When it becomes easier to immunize, especially with the AstraZeneca type vaccines, it will be much easier to immunize such people in their care homes, etc. Only time will tell what we can do. So the trouble with the Pfizer, BioNTech, Moderna vaccines is not only the cold storage that we talked about, but also transport. In other words, you can't move it around too much. You're only allowed to move it twice in its journey. So again, it is difficult to bring that sort of vaccine to somebody in their home who is bedridden. So just wait. When the AstraZeneca type vaccines become available, that will be a lot easier to do.
Right, and another questions that I'm receiving are related to allergies. Someone has asked that, is it possible to take the vaccine shot if I have a sulfur allergy? And someone has asked that they have erythromycin allergy. So should they be going for the vaccination shot or not?
Well, the answers are that if you have severe multiple allergies, you do not have the AstraZeneca, the Pfizer BioNTech vaccine. That's the only one licensed in the UK at the moment. If you have singular allergies, as you just mentioned, it isn't a contraindication. Having said that, discuss it with your GP, the extent of your allergy, because your GP knows you better than I do. But empirically, my advice is most people should be suitable for the vaccine. Don't deny yourself the vaccine because you think you may have some sort of a condition that stops you from having it. So discuss it with your GP. Only if you have severe multiple allergies are you told not to have the Pfizer BioNTech vaccine.
Okay, so, and
Yeah,
Dr. Solanki, yes.
Just wanted to add on, like whoever has got a little bit allergy or all, you can take the vaccine, because having the vaccine is important than not having the vaccine. Because
Indeed.
if you have the vaccine and if you get some COVID infection, the severity of that, you might get some infection here and there, but the severity up to going to the ICU and respiratory distress, you might not reach that level. It will be just a mild symptoms, and
Yes.
that can be avoided.
Okay,
for
so it may
example,
not be completely foolproof, but it definitely protects you, it shields you as far as the intensity or the worsening of the COVID comes in. Yes, Dr. Solanki, you want to make a point there.
So I was saying that I myself have a hay fever and pollen and a dust allergy. Plus I don't dye, so I have a hair dye allergy as well. I got vaccinated last Friday, no problems at all.
There you are. Thank you. Good.
Okay, another question that comes to mind is, do you still have to wear a mask after vaccine?
Of course you should.
Yes.
Of
Yes.
course you should. Because the vaccine, complicated business, but the vaccine doesn't sort of prevent you from getting mild illness.
Mhm.
It may prevent you from getting severe illness. You might have mild illness and be infectious to other people. Therefore, all infection prevention procedures you must continue after getting the vaccine. When we have herd immunity of a large number of people immunized, then we can start debating whether you can drop your guard with masks and things, but not at the moment.
Okay, so the sense that we're getting out of this discussion, Dr. Pankhania, is that you cannot let off your guard. I mean, you still cannot return to normalcy. You cannot return to the world which was there before 9 months before. So we still have a little long way to go.
Of course we do, but one thing that we have not addressed, and I really would like people to think about it, is prevention. How did this virus arise in the first instance? I want you all to lobby, to make a noise, to stir up and tell politicians living like the way we are living is not sustainable. If you carry on messing around with nature, you will get viruses like this. Mm-hmm. So don't mess with nature. You need to practice prevention. And prevention equals things like not capturing millions of bats and putting them in custody with other animals so that reassortment of viruses happens. Most of these outbreaks, Nipah virus, Ebola, Zika, SARS-CoV-2, are as a result of messing around with the environment. We need to get real to protect Mother Earth and not allow these bad things to happen. That's where we need to be exercising our energy and prevention.
Okay, another question that I'm getting is about the cancer patient. What about the cancer patients? What is the advice to them as regarding the vaccination?
Well, have it. There is no contraindication.
Even if you have a cancer and if you are on an immune
Doctor?
Sorry. So even if you have cancer and even if you are on immunosuppressive agents, you should still get vaccinated.
Yes.
Okay. So the only prevention is keeping a social distance, or rather physical distance, and wearing your mask and following the hand hygiene. But a lot of people still do not know how to wear a mask, what kind of a mask is better suited, which can provide the complete protection. A lot of people still have little doubt. A lot of people wear cotton masks. Some people wear N95. Some people wear some other mask with respirator. So which is the correct mask to wear and what they should not be doing? Because as you said, Dr. Pankhania, that this is the only protection, what now we believe is foolproof, and we can say 100%?
Well, nothing in life is 100%.
95%.
Nothing in life is 100%.
95.
Look, let me tell you, my sister, this is a protection called multiple layers. So if you do multiple layers of protection, you get better and better and better protection. Avoid the 3 C's. You wash your hands and you wear a mask. And then you get immunized. And when you have all those layers lined up together, you have greater and greater and greater protection. Okay, so how would you do it? I don't want you to have expensive masks or anything like that. The WHO recommends the outer layer of the mask is water repellent tight weave fabric. So it's water repellent and tight, meaning small pores. That's the outer layer. Then you have an inner absorbent layer. So something which is like cotton wool, but it is highly absorbent of moisture. And then finally a third layer, which is also cotton or similar, which is also absorbent, but it's not as soft as cotton wool. So those all 3 things put together, and it has to fit properly. So you don't wear it on your nose like this over here. That's ridiculous, right? You put it over here and it really has to cover this, right? And it has to be snug fitting. So tight, snug fitting, proper mask, not an expensive mask, will do the job. One more thing, and I get it all the time, is, and my colleagues here on the panel will tell you, I have chronic obstructive airways disease, Dr. Saib. I can't wear a mask. I say, Saib, when you come to be my patient, I will help you with a mask to give you nebulized salbutamol and steroids to save your life. What are you telling me you can't wear a mask? Come on, on the risks and the benefits are phenomenal. I appreciate some people find it difficult to wear a mask because they feel a bit like agoraphobia, claustrophobia type situation. There you have to slowly acclimatize yourself to wearing a mask. The mask is there to save your life. Why are you taking chances with your own life? Come on. It's a simple message. It's going to protect you. It stopped you from dying.
A lot of people, they think, Dr. Pankhania, that it's going to damage their lungs. If they breathe in their mask for long.
No chance. This is nonsense. Your oxygen level is not going to drop because you're wearing a mask. All you are doing is capturing the droplets from your breath to infect others, and the other droplets which are in the air coming towards you to infect you are being stopped by the outer layer, inner layer of the mask. So it's nonsense to say my oxygen levels drop because I wear a mask. Not true.
Because
and what about the
as a surgeon, we do, sorry.
Yeah, please.
As a surgeon, we do so many surgeries. We do 10 hours, 12 hours surgery sometimes with the mask. We still maintain our oxygen. So that should be okay.
Exactly.
True.
Exactly,
But
Dr. Ingle. Yes.
Common man thinks that, okay, doctors, they have learned the art of wearing a mask, but it becomes really difficult for them. But yes, true. If that is the only protective gear that you have, then you have no other option, and you should not be even thinking of any other option.
But somewhere I had said about Ajita, just about like a common person, if they are wearing a cotton mask, just a cotton, they are not having any other thing. So at least there, if you can have 4 layers of cotton, and then you wear it properly with, as Bharat said, with snugly fitting 4 layers of cotton, that should also protect more than 60%.
Right. And the question that I'm getting here is that can I use my mask if I've worn it for 10 to 20 minutes again?
Which type of mask? It depends on that.
Right. Of course, you cannot wash N95. It's only the cotton mask that can be washed.
I see no harm in wearing a mask if you don't have any other option.
Correct.
Right. No, but what is the correct way of using the mask, in the sense that a lot of people, they handle their masks from inside as well. So they probably do not know, like surgeons, they are trained, doctors, they are trained, they know how to handle the mask, but common people, it's a new thing for them. So they're still under training. They're still learning the ways of wearing a mask and handling a mask.
See, practically we wear for a session. A session for us is like we do a clinic for 4 hours or something. We wear for a session for one mask full time. We do touch with our hands and things, and I have not yet come across any problems at all. Practically, I would say no problem. Wear it for 2 to 4 hours.
Correct. Correct.
Right. And what about
Correct. And if
N95?
you're wearing a mask like this, suppose like this, and try not to touch in front. If you touch also, because a normal tendency to adjust the mask and touch it. But after touching, don't touch from inside again. If you're touching like this, you can wash your hands, as we had already discussed about washing hands on and off again and again. So that is very important. Even if you touch, then again don't touch from inside, but just wash the hands or gel it.
And for how
And
long
when you're
can one
removing
use?
the mask, you should not remove like this, because you're already doing that. So you just move it like this and just throw it.
4 hours, I say.
Okay. And
Somebody asked best way to wear a mask for people with glasses. So suppose
yes.
if you have glasses, you wear a mask, apply a small tape here, so your glasses will not fog.
Mm-hmm. And how many times can N95 be used?
If you're doing an aerosol generated procedure, N95 only once.
Once.
Okay. And for other people, like for the rest of the people?
Other people is same, like as a normal mask.
Okay. So they can use it a couple
Full
of
day?
times? Full day, and then
I
can
think
they
they said
reuse it?
they said 6 to 8 hours. In some paper I had read about 6 to 8 hours you can wear that.
Yes, you can.
Okay, correct.
In normal life, most people are not wearing it as long as doctors and surgeons are.
Yeah.
So most people will be okay for wearing it for, for their day's activities of going to the shops and things like that.
Only if you're going in a crowded place, you need a mask. But if you're going to a place which is open, you don't have many people around, you can
That's
do
true.
without it.
That's true. So if you're going for a walk in the woods, why would you need a mask? There's nobody there to infect you. So again, I go back to the original thing that I was telling everyone, which is human beings infect you. Stay away from human beings. If you're out for a walk with your family or your children, your wife, your husband, they are part of your group. And you're not interacting with anybody else, fine, you'll be fine, absolutely fine.
Right. And what about people who want to go out for brisk walk or jogging or any physical exercise?
Nothing more?
Ideally, when you're jogging and brisk walking, so you should not wear mask if you're in a public, garden and all. So that should be avoided, because I have heard about one of my friends related jogging, a young person around 40, 45, and he had desaturation, and he had a massive heart attack because of that, when he was wearing mask and running almost for 30 minutes.
Okay. Dr. Pankhania, what are your views?
Yes. So these are strenuous activity type issues, but most people are not doing those strenuous type activities for, under a situation of wearing also a very tight fitting mask, because by the time you get desaturation, etc., you have been wearing your mask very tightly. Maybe it's one of those N95 types, and it's unnecessary. So you don't want to overdo things,
Okay, so now coming one by one, starting from you, Dr. Ingle, what do you think when the world would return back to normal? Now, so many things are happening since vaccine is also there, and maybe some more advancement we may see in coming times in that too. So what do you think? When can we hope to be the way we were?
I think it's too early to say into that, because we are having vaccines, and plus, one flight here to there, we carry so many jumps here and there. So that's why the flight ban is also there. So that means that every person, or most of the person, more than 60 to 80% has to be or for the vaccine or herd immunity. Till that time, I think we are not safe. Till that time, we have to be alert, be careful, prevent as much as possible, and follow the norm: social distancing, hand washing, avoid group crowds and all those things. And it might take, but as we are taking every year, we take flu jabs as a regular one. After 1 year also, we might have to take these vaccines regularly.
Dr. Solanki, what do you think? How can we make things better in short term and long term?
In what way? I mean, sorry.
In every which way. I mean, to get back to normalcy.
One of the things I think, do we really want to get back to normalcy what we were before? Because lots of things have happened good for this pandemic. Like, see, the meetings we are doing, we are connected from all over the world by Zoom. You know, you don't have to fly over to get a conference in London or somewhere, you know. Many of my conferences and meetings has happened via the Zoom. So we are saving a lot of carbon footprint by doing these kind of things. So a lot of things are good, like working from home, lesser traffic on the road. So I don't want to back to normalcy kind of, but I want the normalcy without the mask. People should roam around. People should get to the, to the supermarket. And I hope everything should be okay by August next year, I think, when the whole population is vaccinated.
Okay. And Dr. Pankhania, what would you say?
I agree with my fellow panelists' views, and we keep on promising that good times are around the corner. Prime Minister Johnson said Easter and then Christmas and so on. My view is we're in this for the long term, and we have to go slowly. This is a long marathon. The important bit is remain alive, and once the vaccine kicks in, you're protected by an additional layer of protection. And one more reason, after you have succumbed and got better with the pandemic, hold your leaders to account. Some of the leaders that we are choosing are lousy. We need to have better governance. We need better preparation for pandemics. We need better support for the doctors and nurses and the healthcare systems. So choose your leaders properly. Don't just vote because you think I've always voted blue or red or yellow or whatever. Vote carefully and boot these people out who don't keep their promises.
Well said.
Well said. Yes, Dr. Pankhania. And I'm still receiving a lot of questions related to mask. Surprisingly, I mean, people really have a lot of confusion out there. And one more question I would want to take up. I just received that can we use the mask? A lot of people, what they do is they use the mask and keep it in their bag for some time, and again they take it out and use it. So is this the right thing to do?
No, my advice is, listen, you need to have a little bag with you, a little plastic bag. So that little plastic bag in your handbag or in your jacket pocket or in your trousers pocket, wherever, but a little plastic bag. This is important. So you take your mask out and you neatly put it back in this little plastic bag, a little pouch, because otherwise what you're doing, think about it, common sense. You're introducing a dirty little mask straight to your face, your mouth, your nose. You don't want to do that. You might be introducing all sorts of stuff to your nose and mouth. Put it in a clean place so that when you put it back on, the mask is otherwise clean.
And there's one more question. Is this vaccine be really effective for the new mutant of the virus?
Yes, I have every confidence in it. And not only, these are beautiful, beautiful engineered vaccines, beautiful. So if the new virus has a completely different spike protein, it doesn't matter. We can re-engineer the vaccine, re-engineer the code, that's the important bit, and give you a different version of it. No problem. I expect it to work.
And is it must for everyone to have the vaccine? Another question there, or we can do without it and are allowed to travel?
Why would you do that? If you've got a vaccine, do it. It's going to protect you. It's an extra layer of protection.
What about the virus from South Africa? Now I don't
It will
understand that.
protect you. It will protect you.
Any mutation, vaccine will protect. There's no problem into that. One spike here and there, but at least other 99.9 spikes are already covered.
See again, I would take to the analogy for the layman. Say the virus head is the same. They only change by mutation is wearing a speck or a beard, and the cells.
Putting a mole. Putting a mole.
The cells will recognize the head in the body who is coming and attacking you. So
correct.
That is how it is.
Yes. So I think we have addressed almost everything out there.
Some people wanted some Gujarati something. I think on the questions.
Oh yes, people who want to be answered in Gujarati and want to ask in Gujarati, if we may ask them to raise their hands. Very quickly, we'll take few questions. Though it's been very beautifully explained.
Till then, we can say in a little bit of Gujarati, I will say.
Okay, please go ahead. Yes. Few important tips.
Yeah,
yes.
So મારું એવું કહે છે કે આ વાયરસ માટે આપણે બધાએ વેક્સિનેશન લેવું જરૂરી છે. બધા લોકો જે 16 વર્ષથી ઉપરના હોય એ લોકોએ વેક્સિન લેવું જરૂરી છે. કોઈ પ્રોબ્લેમ નથી. તમારે બ્લડ પ્રેશર હોય, હાર્ટ પ્રોબ્લેમ હોય, કિડની પ્રોબ્લેમ હોય, કેન્સર હોય, તમે એ બધાથી વલ્નરેબલ છો એટલે તમારે આ વેક્સિન લેવું જ જોઈએ. અને પોતાના માટે પણ નહીં તો બીજાના માટે પણ આ વેક્સિન લેવું જોઈએ. સો પ્લીઝ ગો અહેડ અને વેક્સિનનો ડોઝ જો તમને બોલાવવામાં આવે તો લઈ લેજો. That is all I would say.
Wonderful, Dr. Solanki. Dr. Ingle, do you know Gujarati?
Sorry, I won't be able to explain in Gujarati.
Okay, Dr. Pankhania knows Gujarati. Dr. Pankhania, very quickly, few essential things that you would want to say in Gujarati to Gujarati speaking people who just understand Gujarati only.
મારા બધાને મારા ખૂબ નમસ્તે છે. તમે બધાય તમારું ध्यान રાખજો. વેક્સિન્સ હમણાં જ આવી જવાના છે 2-3 મહિનામાં. સો શું કામે તમે 2-3 મહિના વાસ્તે બીમારીની એવી રિસ્ક લ્યો છો? કોઈ રિસ્ક નહીં લેતા. ઘરે બેસો. બધું સારું થવા માંડશે. પણ ખાલી 3-4 મહિનાની વાત છે. પ્લીઝ ઇંગ્લિશમાં હું કહું છું, ઇન્ફેક્ટ નહીં થતા, કોઈક બીજાને ઇન્ફેક્ટ કરતા નહીં. ધ્યાન રાખજો, શરીરનું ધ્યાન રાખજો, હલવા જાજો દરરોજના અને જરાક વજન ઓછો રાખજો. બસ. થેન્ક યુ. મારા નમસ્તે.
એક ક્વેશ્ચન હતો ગુજરાતીમાં પ્રેગ્નન્સી માટે. તો પ્રેગ્નન્ટ લોકોએ વેક્સિન ના લેવું જોઈએ. પ્રેગ્નન્ટ અને જે લોકો વેક્સિન લે એ 2 મહિના સુધી પ્રેગ્નન્ટ નહીં થવાનું એ પણ ધ્યાન રાખવું જોઈએ.
Ajita ji.
Wonderful. Yes, I think that's been beautifully explained there. And the crux of the matter is that go out, take the vaccine, but even after vaccination, you need to protect yourself. Don't think vaccination is the end of it all. You need to wear your masks properly. Masks are the only bestest and safest protective gear that you have, whether you have taken the vaccine shot or not, whether you have had the COVID or not. Even if you have had COVID, go out and take the vaccine, as it lowers the intensity of the infection, God forbid, even if you catch it. I think we are not missing out on anything, Dr. Pankhania, Dr. Solanki, and Dr. Ingle.
You summarized it well. Thank you.
Ajita ji.
Yes. Yes, Dada.
Can I just say a quick one, because I wanted to forget to mention that actually we are very thankful, and I'm sure all the viewers are they agree with it, that Dr. Pankhania, the Bharat Bhai is when I request to come to this program there, and I said, look, can we have a program after the Christmas so at least we can give them a good chance to them, and his answer was very, very touched to me, and I wanted to say thanks to him as well as the other panel. But the Dr. Bharat Bhai said, look, Mahendra Bhai, people are dying every day. Why are you waiting until after the Christmas? You tell me and we will be there. So personally, that that touches my heart to these words, and I wanted to personally thank you to Bharat Bhai, who actually encouraged me and my team, obviously, to join me to make it this is successful and very, very interesting and intelligent answer we received this. So that is my only personal thank you on my personal level.
Thank you. It's always been my pleasure to be helpful, and I'm very grateful that you set it up in record time. We only had a conversation a couple of days ago, and I said to you correctly, why wait? Every life saved is a life worth saving. So I'm really grateful to you, your organizational skills, your ability to get everybody together and make this happen. Fantastic. Well done to you.
Ajita, just one more question. Sanjay here. It's really a question for all three doctors, Dr. Pankhania, Dr. Ingle, and also Dr. Solanki as well. Many messages have been coming up by people saying that they receive 4 or 5 social media videos and messages and fake news and everything. I mean, what's your suggestion to all these people who are sitting there on WhatsApp and getting all these fake news that are coming in from all parts of the world?
Simple, ekdam simple. Have a rest from social media. Take a break. It's going to scramble your brain, and it will twist and turn and make you go mad. So what you want to do is you have a strategy, and you say, એવી રીતે જો હું તમને ગુજરાતીમાં કહું, જો તમને એમ કહેતા હશે કે આ બુક વાંચો, ઓલી બુક વાંચો, ઓલી બુક વાંચો, ઓલી બુક વાંચો. હજારો બુકો છે, એક બુક છે ભાગવત ગીતા. તમે તમારી બુક સરખી રીતે વાંચો. You don't need other reference books. So what I'm trying to say is our social media ma hajaro social media ma badai movie banavi sagine tamne dekhadi sage. What you do is this. Mari Bhagavad Gita CDC website, Centers for Disease Control. I used to work there in Atlanta, United States. So CDC ni website, EC, BG, ECDC, European Centers for Disease Control. Very good. 3G, Public Health England. 4th one, WHO. If you follow ECDC, CCDC, PHE, WHO, that's more than enough. You don't need any more. The BBC is also very good. So I'll add one more, BBC. And that is enough. And don't let your brain be scrambled with all these people giving you fake news. Simple.
And also, just one other thing as well, this is really for Dada. You know, today, as you've seen that with our Zoom call, it was full up within 2 or 3 minutes of us starting the program. Many are still messaging outside of the actual Zoom call as well. Many are asking, please, I think this type of Zoom conference should happen again. And I hope that all three doctors can come back on again, and then we can repeat this again, Dada, at some stage in the next few years, because there are hundreds of people who have been messaging, wanting to come on to this Zoom call, but they've not been able to get on.
My pleasure.
Sanjay,
always a pleasure.
Sanjay, I'm sure everybody will help us as much as we can, and obviously thanks to Ajita Jain at the moment. Probably is nearly I would think it's 12 o'clock midnight in Lucknow in UP, and still you know, the anchoring very well. So it's a collective work there, and this is the time to pay back everyone there. And personally thanks to doctor that actually એ લોકોએ બધું આપણે સમજાવ્યું છે, આપણા વડીલો માટે એનો કામ માટે આવ્યું છે. તો let's work together, and we will guide by the the Dr. Bharat Bhai, the Solanki Sahib, and Vijendra, the English side. And let's make the things, whatever we can do for our community, it's a all blessing to everyone. So that on that note, we will do whatever we can do in the next as early as possible.
Dada, just take somebody asked a question about Guillain-Barré disease in the so એમને હું કહેવા માંગુ છું કે GB syndrome માં બી you can take the vaccine, no problem at all, or any other neurological disease, MS કે કશું પણ હોય તો બી. And the last one, it is free of egg and free of animal protein, so you must take it in. It is vegetarian.
One point I think that we have missed just now, it stuck to me that here in India, there are a lot of talks of immunity boosting measures, and I'm sure everywhere else too. So like taking vitamin C, taking vitamin D, taking zinc. So does this all help in boosting up the immunity, and what can be done to boost immunity?
Okay, Ajita Ben, let me jump in. I'm sorry, my fellow panelists, I'm being mean by jumping in so quickly. This is my job. I do it every day. Okay. Right?
We love it. We love it.
Yeah. we have to be evidence-based. Okay, so the evidence of these so-called immune boosters, where is it? Where is the evidence? We haven't got that evidence. So what would I say to you is eat well, sleep well, exercise well, have a varied diet. And if you have all those things, you're doing well. One more thing, because we live in the United Kingdom where it is dark 6 months of the year and we are dark-skinned people, it might be, and most of us are vegetarians as well, it would not be a bad idea to also have your vitamin D supplements. It's a cheap medicine. Get the cheapest one you can get. 1,000 units per day is more than enough. Okay, the government recommends even less than 1,000 units, but being dark-skinned and all that, I go with 1,000 units. That's a supplement, but we can't mix it up with vitamin D stopped me from getting coronavirus. That's not true.
Yeah.
What will stop you from getting coronavirus and dying is infection control. What will stop you from getting severe illness is being fit and healthy. Go for long walks, eat well, sleep well, have your supplements. Thank you.
Wonderful.
This is very well summarized. And instead of going for social media, WhatsApp University or something, they say like that. So if any problem is there, I think just phone a friend. That should be the approach. Anybody from the health care or health worker, doctor, nurses, whoever is your friend, just phone a friend and take better advice than the social media. Something they say like that.
Great. So on that note, now let me invite Mr. Yatin Daura. He's the president of Lohana Community to give vote of thanks. Yatin, bye.
Thank you. Thank you very much, Ajita. How can I start? Really, the first thing is, I think the three panelists deserve a big round of applause. I think you've done excellent. In my opinion, the fear is more dangerous than the virus itself. And these three panelists today help us to be more aware of specific how to control ourselves and how to get not infected. So I'd like to thank Professor Dr. Bharat Pankhania, Dr. Vijendra Ingle, and Yogrendrasinh Jagatsinh. It is amazing what you come and told us about it. As we said, there were 500 on the Zoom and another 500 could not join us, so it's a big crowd. One question I have for Dr. Professor Pankhania. The university has come up with a lot of professors because your colleague like Professor Kotecha is from the same university you are. What is the secret there, specifically from university, you're getting so many professors come out from there?
No, there's no secret. We are a self-selecting crowd, so I have been a student all my life. That's the way it is.
Okay, that explains it. So yeah. Well done, really. Thank you very much for you joining us. Ajita, Jane, I think as Dada's already said, it's midnight there, and the way you conducted really the question and answer is amazing. We're truly grateful to you. And coming out with your style of, your journalism, I think helped us a lot of people. So we're truly grateful, and you've been here all the time as well. I also like to thank the committee members, specifically Mahendra Jadeja. He's been instrumental in bringing these panelists to us. Praveen Bhai Amin as well, who's helped out quite a lot. Vimal Patel, Anita Ruparil, and Sanjay, and a lot of other people. So I'm really grateful to all the committee members who's helped. My special thanks to the organization who supported this one, the National Association of Patidar Samaj, Gita Foundation, Chagam, Nagrik Mandal, our community, Lohana Community, Lotnand, Asian Foundation, and Vivekan Center. So we're truly grateful to those as well. I also like to thank all the panels, also all the audience who's joined us. I think your specifically the questions you ask and so forth, extremely useful. Now, as Dr. Pankhania and the panelists says, be safe in Christmas time. And if you have nothing to do, then you can join us. We have specifically organized for the Gujarati thing, event tomorrow and on New Year's Eve. So don't go out, do shopping or go and meet somebody, join us up, and you will really entertain you live from Gujarat. So thank you very much, and thank you all for joining us. Great work.
Thank you very much. Thank you.
Thanks.
Event tomorrow, and I'll see. Don't go out, do shopping or go and meet somebody. Join us. I know where that was coming from. So thank you very much, and thank you.
That was good. That was good. I just want to add one thing. Hello. Yeah. Can you hear me?
Yes.
Go ahead. Yeah.
Yeah. Okay. Just want to say one thing. One positive thing in this corona is that people are doing yoga at home. On Zoom, there is so much of opportunity has been created by yoga that people are really taking advantage and getting fit.
Okay. I think we're done, right, Ajita?
Yeah, we are
So
done.
thank you very much for all
Thank
of
you.
you. Okay.
Thank you, Ajita, and thank you, organizers.
Thank you very much.
Thank you very much.